A very, very warm welcome. This is Mark Drax speaking on behalf of SASH, and today I have the pleasure of interviewing Greg Futral and Leah from Pine Grove, who are going to talk about Pine Grove, their position in the world in this industry, and also perhaps in relation to our upcoming conference. A warm, warm welcome to you both.
Thank you.
Yeah, thank you, Mark.
So
all
guys,
right, well,
we'll head straight into some questions because I sent you a few questions just recently. So if that's all right with you, we'll just launch straight in and you can give you ample opportunity to talk all about Pine Grove. How's that?
That sounds great.
That sounds great.
All righty. So question one, what do you think makes Pine Grove unique in the industry?
Okay, well, I'll start with that, Mark, and let me go ahead and introduce myself a little bit further. My name is Greg Futral, and I'm the director of our Gratitude program, which is our in-house residential and partial hospitalization program for sexual compulsivity and addictive issues. And so I've been here since about 2009, working with the program, and became the director a couple of years ago. And then I spent some time working at Pine Grove previously as well as a clinical therapist on our inpatient units. And so, so I guess one of the things to talk about what makes Pine Grove unique in the industry, or what we kind of bring to the table, so to speak, is part of what's also kept me in the system and in working here for so long, and coming back even after school. Some additional school to come back and work in this, and that has to do with the people here and the teams that we have put together and work with, and a longer term administrative team with lots of experience over the years, and the amount of different services and levels that we're able to offer as part of our treatment process. And so, as I said, I used to work on our inpatient acute care programs and did that for a number of years. And then I've moved more into the residential side of things. But one of the things I've always appreciated the most is how many different services that as Pine Grove, as a system, that we're able to offer to people. So, for example, when somebody's in one level of care, be it outpatient or be it with us in one of our residential programs, and they need a higher level of care at the time, or maybe they become in more acute distress, something like that, we're able to refer them easily over to one of our other levels for some temporary care, and then to come back and continue out their stay. So I really appreciate having all of those things available to us and to our patients. And I appreciate the connections and the support of the people within our system. That's been a really great thing to me over time. I love working with teams and working with all of that. So that's part of what's kept me here as well. I think that being part of also we're part of we're the behavioral health division of a not-for-profit county hospital that's in this area. And so that's also being a part of a medical facility that we can also help facilitate those needs when needed for people if they have acute care needs as well while they're here. Sometimes we need to connect them to other areas. And so, so it's just being a part of that overall system has been a very rewarding experience for me. And I think it helps us provide the best care to our patients. We're also, within that, over the years, we have identified a number of areas that have become more specialized targets for us in terms of treatment. And I'll let Leah talk a little bit more about that. But for example, our professionals program, specifically our professional enhancement program, but also our work within all of our programs with professionals, that's been a big focus area of ours over the years. We have an older adult program for substance addictions, and so that's been more of a recognition of the need out there, and to help target a specific area to help different populations to feel most comfortable and get the best work done within that. So I think we've been able to adjust and adapt to some of that over the years. It's been another positive thing for us, and the strength for us, our longevity. So Pine Grove just celebrated, I think it was last year, 35th anniversary. Our specific program that I work with was 15 years last year. And Leah, Claire, what did we say that was how long the professional enhancement program, or PEP as we call it, how long has it been running now?
13 years, 13, 14.
Okay.
Those are some amazing statistics.
Yeah.
Yeah, so our longevity, I think, is part of what we can draw on and appreciate and bring to the table as well. So,
Great, thank you very much. Anything to add to that, or do you want to try another question?
I'll take the next question. I think that was very thorough. Very
That's
thorough.
a very thorough answer. Thank you, Greg, so much.
sure.
One of a sub question to question one is, what are the therapeutic modalities and treatment orientations? Just maybe just specifically identify what those are for our audience.
Greg, you want to take that one?
Sure.
The different programs are going to offer different types of interventions. I mean, I think what it is important to understand with Pine Grove, what Greg was saying about all the way from outpatient to IOP to partial, residential, and inpatient, and all of those treatments, whether they're specialized in the sexual compulsivity or the chemical addictions, they're going to look very different based on which program a person ends in.
It's music to my ears, because I'm in recovery, I've been in recovery for 16 years, and I'm a sex addict in recovery myself. And so I never got to Pine Grove, but I have been to other places. But it's really lovely to hear you encompassing a much broader spectrum than, because I know that sex addicts cross-pollinate with many other addictions and vice versa. So to be able to handle all that on one campus is fantastic.
Right.
Yeah, and again, it's part of what we found is such a benefit to say, Mark, when you're talking about that, we have somebody come in with multiple kinds of challenges and issues, and sometimes they will need multiple services from the different programs. And even though within that we're all going to be working toward the same goal of addressing whatever may be most relevant for that person, and that they're going to need the most for their recovery moving forward. So in terms of treatment modalities, and I can speak maybe best around our residential and partial hospitalization levels, that really I would best describe them across the program as integrative and eclectic, because we don't take one specific model, say for instance, cognitive behavioral therapy that someone may run through on an outpatient basis and simply go to a group or a once or twice a week meeting to focus very narrowly on a type of therapy or a type of course of care, which is very common and of course very well fits with that model. In this kind of model where someone comes and they stay for an extended period of time, oftentimes we're going to incorporate various elements of different treatment modalities. So for example, we were founded around, from this program specifically, around sexual addiction and compulsivity. So we integrate things like the task model of sex addiction. We integrate 12-step and self-help support group into the treatment care. We incorporate different modes of therapies such as dialectical behavior therapy and mindfulness-based therapies, experiential therapies as well into the process. We utilize things like we call it a REACH course, but our ROPES course experiential work that we'll also have on a weekly basis. We utilize yoga and other forms of more holistic and healthy recovery strategies as well. So I really think that the best description of it is integrative and eclectic, and that's going to fit across each of the programs, be it the primary substance addiction programs or us, or much of the interpersonal work that they do with the professional enhancement program. So it's gonna blend a lot of those together.
I think also to add to, I mean, there's a psychiatrist, addictionologist in each of the programs. So medication evaluation and management. The psychiatrists are very much involved in our treatment teams. and are able to help really adjust people's medications and help find ones that are most fitting. So that really supports the therapeutic work that they're also doing along with that.
Thank you so much. Residential psychiatrist, that's a powerful tool in your arsenal. Thank you. Guys, how has Pine Grove, how do you think it's changed over the years, and what do you think keeps you relevant today?
I think one of the things that's been very helpful for us is that we are able to adapt and change and really evaluate the needs of what we're seeing in the population, and being able to create programs that are going to specifically address those needs. So a couple of examples, Greg just mentioned like our legacy program for older adults. We were seeing a lot of addiction in older adults, and also that when you put a 65, 75-year-old person in with 18-year-olds, that they're in different spheres of life, and being able to really relate to one another can sometimes, not that it's impossible, but it can be more difficult. So having that legacy program to where people of similar generation and their needs, they can come together and have specific treatment for them. Another one is with for our professionals. We've had our professional enhancement program for many years. As I'm thinking about, I think it's more like 17. I said 13. It's 17 because I've been here 15.
Wow.
But, yeah, so for the PEP program, professional enhancement, we recognized that we needed more of the professionals in the addiction programs, needed more specific work on their professional issues, including boundaries or return to work plans. And so we created what we call the professionals recovery track. And so all people with their licensed professionals are able to participate as part of their addiction treatment in that PRT course, to where they're looking at their relationship with social media as a professional, or how they're going to set boundaries, or what's going to be different, how their recovery is going to fit in with their professional life. So those are two examples. And I guess a third would be, the industry as a whole has changed in that, it used to be residential and that was pretty much it. But now with the move to partial and with insurance now accepting mental health benefits, I think our administration here at Pine Grove has been very active in, wanting to allow as many people to get access to treatment as possible. And, being able to accept insurance and those benefits, we try to work as closely as we can to be able to get people so that their treatment is paid for as much as possible. So those are some ways that I think that we've adapted and changed, because it is from 15 years ago, this is a different world. And from 35 years ago, I think it's a drastically different world.
Well, let's not forget the fact that six months ago, it was a very different world.
That's such a great point. That's such a great point. Nothing is the same.
I think we're all having to adapt pretty quickly, whether it's wearing a face mask to go to the supermarket or walk around your center. It's an extraordinary.
Exactly.
No, thank you for that explanation. And of course, I noticed you mentioned social media. I mean, what better way to exemplify changing times than to have to build that into a program, because it is such a nemesis of so many of your clients and mine, I'm sure.
Right. Absolutely.
Good to hear. Thank you. Briefly, tell us about your staff, perhaps training and experience. Just give us a little flavor of, you've mentioned you have an on-site psychiatrist. I mean, CSATs, et cetera, et cetera. How do you have in-house training, or tell us a little bit about your staff and training.
Okay, and again, it does vary across the programs, but but we'll have a psychiatrist and psychiatric nurse practitioners that work within the various programs, and I'm speaking more to the residential and partial programs right now, but they will work closely with our teams and sort of cut across those programs. Within the programs, we typically are most of our therapy services are provided by licensed master's level clinicians. They may be from marriage and family therapy backgrounds or social work backgrounds or counseling psychology backgrounds. So those are going to be our most common treatment providers of our therapeutic course. Now, the training may vary depending on what program they're in or what they're doing. So, for example, within our program, getting a certified sex addiction therapist training is going to be a pretty common part of that. Some type of training around sexual compulsivity and sexual addiction work. Sometimes it may be more, depending on what their focus is, it may be more around family and partner work or partner and betrayal trauma work, those sorts of things. So it may be, we also have a women's specific program that also will work with individuals in more of a female population with multiple types of addiction, trauma, and sexual addiction issues. So also working in kind of focus areas around female sex addiction. So there's a number of different avenues that we might utilize to help our clinicians get the training and certifications oftentimes that may go along with that necessary to help work with that, as well as working with in-house on an ongoing basis with our more long-term staff members and administrative staff who many of us who have been in the system for a long time and are able to provide on-site support, assistance, and kind of guidance in that training and in that team for that.
Superb.
And we should mention, I don't think, Leah Claire, that you actually introduced yourself, but if you want to make sure, you can kind of mention, and if you want to add anything to it on the staffing, but what you are helping with across the programs, and then specifically with the professional enhancement program.
So I am the Director of Clinical Operations here at Pine Grove, and really, focusing on developing and helping develop the staff and improve the programming across our different areas here at Pine Grove. I think one thing, Greg, that we have talked about too about the training of our staff is that we are a training hospital as well. So we have all the way from nursing to medical residents to therapists that are trained in the different universities here in our surrounding area, and we bring them in and are often supervising. So we play or in the role of supervisor as well as we are training other staff and also what they are bringing to us. I think being a part of a training hospital is always a unique addition to what we're doing because they are also teaching us as we're trying to teach them. And so they add quite a bit to our organization and play a part in terms of as we're developing them, they're helping us as well.
It's amazing to hear the longevity. You've both been there for an incredible number of years. I mean, that to me speaks volumes. When staff turnover is obviously a good indicator of how happy people are. When you've been there for 15 years, that's fantastic. So thank you for sharing that.
Yeah.
What can a patient expect from phone call to discharge? I mean, clearly we could talk about this all day, but just give us a rough sort of a monthly time. Typically, how long do they check in for a starter? You do a month program or 2 months, or?
We do a full range, so it's based on the patient need, and so our discharge dates are set. So whether if someone comes in with, and I don't think they exist anymore, is just an alcoholic or just a sex addict, their length of stay might be less than someone who has, we do get people who come in who have been struggling with alcohol or drug addiction that, it's determined over the time that they're here that there's also a compulsive sexual disorder. So they need to also get that work done. So it can vary based on the program. I would say average can be between 6 and 12 weeks for our residential programs. Our inpatient stay is very brief, 3 to 5 days. But when a person calls, they call our call center. And it's a clinician there that takes their information, gets their insurance information, sets up the admission process. So gets that ball rolling, and we can accept them at the date that they choose. When they get in, I think that, we try to do a thorough evaluation. They do a psychiatric evaluation. The therapists are meeting with them. They're a part of the group so that we get a full understanding of all the issues that they are facing. At times we utilize psychological testing when there's more questions than we have answers for, that we'll put in there as well to make sure that we have a full picture. Usually what we at the professionals program shoot for, and I think a lot of the other programs, we try to have that determination within the first 2 weeks of, this is everything we want you to work on, and in collaboration with the patient to make sure that we're meeting the needs and goals that they had coming in. So that as we set that plan and set that discharge date, we're collaborating with them and working with them to get those things met. So like we said, the length of stay and the process of what they participate in can be very different, but we do up front really try to get as best of a clinical picture that we can, so that we can make sure to treat the whole person as opposed to just an issue that they're struggling with. I think also in that weekly or family program is really important. Families are often floundering, as anyone knows that's dealt with addiction. So having family people in each of the program, family therapists in each of the programs that can involve the family. We are doing, during COVID times, we're doing phone calls via Zoom with the family members so that they can have weekly contact with the family therapist and work on the issues and get support for what they're needing while their person's here in treatment, as well as updates on how things are going from their therapist or from their loved one's therapist. So lots of support for the family as well, as their loved one is here with us.
Leah, do you bring the family in at all and give them any direct education? Obviously, accepting that probably you can't because of COVID at the moment.
Yeah, this is one of those adapting things, right? So
yes.
We historically have always had a family program, and with COVID, we've dropped back from that because it was just too dangerous to bring people in and out for a short period of time. But our hope is to go back to that once all these issues are resolved, to be able to bring family back. But we didn't want family members to feel disconnected, because being able to work on those issues and talk about what life is going to be like post-treatment is really important. So involving them in the best way possible during these times.
And on the back of that, so a client comes through the process, which is a very complete process by the sound of things. How proactive is your aftercare system? What do you have in place for that?
Yeah, so we before they leave, we have a weekly discharge planning where we are working with the patient on aftercare plans. So where they're going to go, who they're going to see. So that's definitely part of a person's treatment, so that when they leave here, there's an aftercare plan. I think one of the fun things about our alumni program is that we have what's called Days of Hope, which is once a quarter, people can come back to Pine Grove. It's at no cost, and they could spend a couple of days here in the programming and doing lectures with different people, different staff members, to continue the work of things that they've learned or how they've continued to learn and grow outside of treatment. It offers a huge benefit for those in treatment too, because you have outside people who are having some success, or they've had some setbacks and worked through them, come back and be able to talk to our current patients about that, so they can learn from each other. And so that Days of Hope is part of that aftercare planning that we encourage all of our participants to participate in.
Is that something they can come back once or many, many times?
As many times.
As often as they want. And now we've also adapted right now. We're not bringing them on campus, but for example, we have one later this week that is a virtual. So we have moved right now to virtual. So we're hoping to return at some point to the in-person ones. But we have moved forward to make sure we could still offer that to where they can still connect in and have some good interaction and spend some time.
That's really lovely. When I left treatment, my first treatment center 16 years ago, we had they included for the first year out, actually it might even have been 2 years, every Wednesday night you could come back for an hour and a half and sit with a therapist in the treatment center and just check in. And you know, I was there pretty much for 104 weeks in a row. I mean, unless I was on holiday, I went to that meeting. It was a lifesaver to actually have the follow-up and the continuation of support, because we all know that the hardest part of recovery is when you leave the treatment center. Not when you're in treatment, when you're being mollycoddled and looked after and fed 3 times a day. It's when you leave that's when the real work starts.
Right. Absolutely.
How would you say, or do you, to what degree do you customize treatment to individual patients' needs? I mean, you've talked about this, but is there any specific things you do to make sure that each person really is treated as an individual?
Well, I think that I think actually just by nature of the discussion that we had in the previous questions, I think we already have touched on that. I think one of the ways is that not everyone, for example's length of stay is going to be exactly the same, partly because of the different issues that any one person may have going on. And so what we're trying to do is adapt and tailor what treatment recommendations and what we can offer and or look at with them for aftercare that's really going to address all of those things. And so going back to from the beginning, from the initial assessment over the phone and through to those first couple of weeks, say, of their care, where we're really working on trying to identify as much of that as possible and get a very good picture of what's going on with that person clinically, so that the rest of their treatment and their aftercare planning and their relapse prevention planning takes all of that into account. And so as Leah, just as an example, you know, Leah Claire mentioned around our psychiatry involvement, not all patients are going to need medication adjustments, changes, or starting or will be on medications necessarily, but that's available depending on what people are going to need, and to address and monitor their mental health needs outside of this. So say, for instance, it's depression or anxiety or something like a bipolar disorder that's going to need some medication monitoring and adjustments or something over time. So we're working on addressing that as part of their treatment, or be it their trauma history or something to that effect. So so someone may need some more specialized specific trauma care while they're here. And so that's something that we can identify with them and work on what kind of recommendations would help them now while they're in a structured, contained, more environment, as well as what they're going to need over the longer term. So drawing on each of the different professions and types of staff that are involved, the assessment process, and from beginning throughout their care helps us to customize and individualize it to them, as well as what their goals are within that, of course, right? Like, what are they identifying as some of the major things that they're needing to work through? Sometimes it's part of their relational issues and their family impact and all of that. So I think there's many ways that we do. We probably already have touched on them briefly, even leading up to this.
Guys, thank you so much. I've got one last question for you, and it's pretty relevant considering what's going on in the world. The simple question is, what are some of the greatest challenges facing Pine Grove in a changing world? I mean, clearly COVID, huge, but what else?
COVID has been massive. And that, I think, is, you know, as you look at this question and kind of think about it as I have, you know, it's the challenges that bring about change. You know, when we get uncomfortable and we're forced to look at these things, I look at all the growth that we've had during COVID, for example, of all the different services that have been, and we've had to look at, like with family program or with our alumni, and being able to hopefully continue some of these Zoom meetings that we've had and be able to reach people across the country in the years to come. And so there are definitely challenges that have come about. I think another major challenge that we face is around insurance. I mentioned before, we want to be able to work with people's insurance, but you get a 2-week stay for someone with a severe personality disorder on top of an addiction, and it is hard to to work with that and to get the person the help that they need in 2 weeks. So sometimes you have to create a lot of different things, but that's been a significant challenge as we've engaged and embarked on the insurance world to help people and come alongside people, because finances, that's a significant issue for every person who comes through here pretty much. So we want to be able to work with that as well. Can I say one thing I forgot to mention before about the ways we've changed?
Absolutely.
I meant to mention before about the Women's Center that we've added a trauma track, or really it's not necessarily a track, but we're accepting women with just trauma that they need to work on, so they don't have to have a primary addiction diagnosis. We found through the years that there's there are many women that need a reprieve of a residential or partial level of care to be able to find the safety to be able to address those needs. And so we've recently adapted programming and the Women's Center at the Women's Center to be able to have a focused trauma program, which has been very exciting over the last couple of months as we've added that in to help those women who are really struggling and need a safe place to be able to work through those issues.
I think that's so important to be able to, because the incidence of abuse of women is tragically large. So to be able to offer women a haven to just address trauma, because it's, I mean, I don't work with women myself, but I've been amongst in treatment with women, and it's so hard for some women to feel safe enough to address what they really need to, because they don't want to be labeled with something, but they have got a serious problem. So that's really lovely to hear.
Yeah, absolutely.
Guys, we've been chatting for almost half an hour. Any final closing thought? I know time flies when you're having fun.
Time does fly.
Any closing thoughts?
I don't know. We did cover a lot in this, but I'm hoping that we're able to give people just a sense of who we are, what we offer. If somebody has other questions for us, they can always contact us through the website and through phone calls, through emails, any of that. You can find that on our website at pinegrovetreatment.com. And I think that's one of the biggest things is just that we're happy to connect with others, to consult with others, to help along the way, to try to help identify just what people need and how we can best help them meet those needs. So
That's right.
Greg, Leah, thank you so much. I'll stop this recording, but don't go away. It's been an absolute pleasure talking to you. And I'm sure you'll do this on the SASH YouTube channel before long. Leah gets these up pretty quick. It's been an absolute pleasure. Thank you both so much.
Thank you for the opportunity.
thank you.